Hi, my name is Kathleen, and I am a nurse case manager with Paradigm Health Hospice. I wanted to tell you a little bit about myself and my journey with hospice. I first got interested in hospice when we put my dad on hospice a couple of years ago. My parents lived in Florida. My dad had Parkinson's, and he fell and broke his arm. And in order to keep him out of rehab and with COVID going on, and we wanted my mom to be able to see him, we chose to bring him home and kind of rehab him on our own. I went down to Florida for a couple of weeks to help my mom with that and found signs very quickly that we had end of life. And I wasn't quite sure what that looked like. We contacted his primary care doctor, and he allowed a hospice company down in Florida to come assess my dad and kind of see where we were. From day one, when those hospice nurses came in, I knew that was something I could do. The way they connected with our family, the way they listened to our family, the way they understood that 24/7 care was a big job. They put their arms around us, they helped us with that journey. When I left Florida, I knew it'd be the last time I'd see my dad. As that hospice journey continued and the hospice nurses would come in and take care of him, I knew I wanted to start that process of helping other families because I knew how much they had helped us. As my dad passed away, I knew I wanted to be the best hospice nurse I could be because in the way he passed away, my mom wasn't real sure what was going on. The nurses down there I know educated her, but it didn't click with her, and so he did pass away, and it was kind of unexpected for us. And I knew when I came back home and started this hospice journey, I wanted to learn everything I could about hospice and the different symptoms and what can we do and how can we support families. When I joined Paradigm in April of 2021, it was the best decision I ever made. I learned a ton within that first year. I learned how to meet families where they were. Every family is a little bit different. Every family has different dynamics, different ways of learning. Some families can learn by just me talking to them. Some families need visual type education. And so it's always a challenge trying to get to know those families quickly because you want to be able to help them in that journey. When my dad passed away, I realized hospice that we should be celebrating end of life just as much as we do the beginning of life. And I always take that into my practice. I promise all my families and my patients, I have three goals for you. I'm a pretty easygoing person, very easygoing nurse, but I have three goals: peaceful, comfort, and as little pain as possible. Every patient's journey is different. And as being with Paradigm for the past year, no two situations are ever the same. Everybody is a little different. Everybody goes through their journey a little bit differently. I have some patients that maybe want to experience a little bit more of that dying process, and maybe they don't want to take medications to where they don't feel as much pain. Sometimes they want to do that, and that's okay with me. I kind of view that type of journey as the same type of journey with pregnant moms. Some pregnant moms want to go through that whole labor aspect, and some don't. And that's okay. There is no wrong answer. I love educating families of kind of where I think we might be. With hospice, you have kind of generalizations on that dying process. And I've seen people, go from transitioning to imminent within moments. And I've seen them do a slow transition. I enjoy meeting families where they are, helping them kind of accept a diagnosis that I can't change. But I can certainly keep them comfortable and keep them educated and keep them supported while we go through that journey.